Welcome to our live Q&A podcast.
We're 18 minutes late.
We're 18 minutes late. We are not punctual all the time. We were just deep in a conversation with Dane, and it was a good conversation around how people are overdoing it with protocols and supplements and DIYing and all the things. And so another reason why we kind of wanted to do these Q&As, because when we give stories, this is like one of my biggest pet peeves. And I know that it just is going to happen as a creator on social media. But when you try and explain a very complex topic in 60 seconds or like less than 2 minutes, and then people just criticize what you missed. And it's like, lady, I cannot list every single supplement that works for this X, Y, and Z dysfunction in 60 seconds and explain it in a way that is understanding. Like I was listening to a podcast on the way over here, talked about like being an effective communicator and how less is more. Say it with confidence and with determination. And like, honestly, what research shows is that if people speak confidently, people believe them more, even if they're wrong, than if someone that is right is speaking not confidently. But ultimately, to be able to explain very hard conversations and concepts in an Instagram story or a reel is much harder than you think.
Yeah. And my favorite is when you make a post, like someone asked me this past weekend about bedwetting and like all the things it could be. And then I got multiple people that were like the airway issue. I'm like, yes, it can be that too. It's this one story post that I'm literally typing on my phone on a Saturday afternoon, like, sorry, I missed the airway. Yes, that can be a big contributor, but this is also where when you're looking at a person in an individual case, I'm looking at far beyond what's going on, outside of bedwetting. Yes. And then I'm going to test and address so that I know what I'm actually like dealing with. But I agree with you. I hear what you're saying. And I did a story. It was probably Friday or Saturday morning. I don't remember. Someone asked a very complex question around SIBO and GERD and something else. And I was like, all right, gut in 60 seconds. Cause I'm trying to be less long-winded because I'm very long-winded sometimes. And then someone's like, you should save this as a reel. And I'm like, of course I would nail it when I look like a buffoon. Like, I just don't care anymore. I try to show people that, I look crazy without makeup and tired because it's 5 a.m. and my kids have been up with me and I am tired, but I'm still showing up to serve you. And then we get on podcasts and we look a little better because we did our hair and, some makeup.
Lighting was nice and all the things. So let's dive in. We got a few questions for our live Q&A today. Mm-hmm. So I actually had 2 questions very similar. One was from Cambriadix and one was from CGC 10811. So they both asked around fibroids. They asked what are causes and cures. The other one asked, is there like a hormonal imbalance component to it? So fibroids are basically, they originate from a single mutated smooth muscle cell in the myometrium, which is basically the uterine muscle layer. And the cell begins proliferating, or what you can call like replicating ultimately, and producing excess extracellular matrix, aka collagen and fibronectin. So it creates this like firm fibrotic mass ultimately. And so what is involved in this, right? There is a genetic factor for sure. Genetic mutations, especially in the MED12 gene mutation, has been shown to like have a play in a significant amount of cases. Growth factor signaling. So I did a reel recently on fibroids and cysts, and one of the main points I made is like, your body is not meant to create growths that are abnormal. So what is going on that is allowing that, right? In this case, in fibroids, there is often increased activity of what's called TGF-beta, which is basically transforming growth factor beta, IGF, insulin-like growth factor, and other proliferative pathways that basically grow cellular growth and fibrosis. So what causes high IGF levels? Metabolic dysfunction, insulin-based issues. So if we are unhealthy metabolically, you will see insulin that act as a cell growth signal. Almost, Liz has mentioned the book on the podcast before, but cancer is a metabolic disease.
Yep.
1,000%. It is a metabolic dysfunction. Are there genetic factors? Are there environmental factors? Of course there are. But at its very core, cancer is a growth that should not be happening.
Yeah. So let's look at our genetics test and like our autophagy genes. And we have our AMPK pathway. We have our mTOR pathway. Many people are stuck and they cannot switch pathways. So let's dumb it down even further: sugar burning versus fat burning. If you can't get into fat burning, ketosis, and get your mTOR pathway turned on, we are going to struggle with autophagy. And therefore, because you're stuck in sugar burning, you're going to sequester and grow disease, whatever that shows up as. It could be cancer, it could be other things in the body, because your body is not getting rid, it's not self-eating and, destroying these things that can essentially destroy us. One thing that I would add here is just iodine deficiency as well. We see that with growth. I think you have to do some deeper investigation as to what's really going on with your levels and what are you doing to support your thyroid? What are you doing to support your detox pathways, your drainage pathways? And then of course, again, your metabolic health. And that's why with the Metabolic Accelerator, so we have this new program that we built that's 12 weeks instead of the 6 months. And it is all around metabolism and inflammation. Very foundational things for people who are doing it all right, but still struggling. Because you might be saying, I don't need all the gut work. And I'm going to tell you, you probably do. But okay, we can argue back that maybe you think that you don't. You probably still do. But it's a little bit more digestible to start with there. And that's starting in March. So March, April, and May. So you need to make sure that you're joining that program now if you are wanting to, understand your labs. So comprehensive labs with hormones is included in this program because we want to look at all these metabolic markers. We want to help you understand. Like I had some questions about skin tags and all these other things, that insulin resistance, which can develop much earlier on before your A1C ever rises or your blood sugar ever rises, is a very real thing. And your doctors are overlooking it. Not to mention your lab range that's normal goes up to 24 for insulin. We want to see you between a 2 and an 8. And really, if you want to be optimal 4 and a 6. So you got to look at a lot of things here. And, I don't know what else you want to say about this, but
I just want to touch on estrogen's role and actually progesterone's role. So, because someone asked around like hormone imbalance, but fibroids are estrogen sensitive tumors. So estrogen increases the proliferation of the uterine smooth muscle cells, and fibroids contain higher concentrations of estrogen receptors than surrounding uterine tissue. So it kind of increases the expression of progesterone receptors within fibroids, which makes them even more responsive to progesterone as well. We see a lot of times this growth happening during reproductive years, and then enlargement during pregnancy, shrinkage after menopause, unless people go on HRT or they have high levels of adipose tissue, which basically perpetuate estrogen growth. And so, however, systemic estrogen may not be high. Like your serum level of estrogen does not have to be high for the tissue level of estrogen and that activity to be elevated. And that's a huge misunderstanding that people don't realize. My serum level's less than 5. I don't care. You are showing very clear signs that the tissue level is elevated. You're having fibroids, you're having migraines, you're having swelling, you're having breast tenderness. I don't care what the serum level tells me. We know that the tissue level is telling us a very different story. Same thing happens with hair loss, which is another story for another day. But the detox and estrogen clearance ability, inflammation plays a role here because chronic inflammation also increases growth factors, stimulates that collagen deposition. And then the last piece is progesterone. So fibroids are progesterone responsive tumors too. And everyone thinks like progesterone is this amazing, safe hormone. Guess what? Progesterone can stimulate fibroid cell proliferation. It can stimulate estrogen receptors. It can push estrogen off of receptors and more into circulation because they fight for the same receptors. So progesterone is not this like amazing, no problems with it, all working hormone. It can create problems too, especially if insulin is elevated, inflammation is present, detoxification is not working properly. So fibroids are so much bigger than hormones, so much bigger, but they are hormone responsive tumors. And so you need to understand that if you are putting hormones into a body that is not in a good place, you are going to create a bigger mess. I cannot emphasize that enough.
Yeah, we see this a lot in terms of progesterone, and people will be like, well, now I am like all watery and inflamed. I gained 10 pounds. It's like, yeah, well, you got a lot of other foundational things that we need to work on first. And then we can bring that in and maybe go even lower and slower to introduce it. Like, I know we've talked about this several times on the podcast, but if you've been without hormones for a long time, throwing high dose hormones in is probably going to create some negative reactions.
Your body's going to be like, what in the actual F? I have not seen this in years, and now you're flooding me with it. Like, what is happening? And why am I having all these symptoms? It's like your body hasn't sniffed estrogen in 3 years or progesterone, and now you're giving it both of them in high doses.
Yeah, we could go on a tangent about that. We'll save that for another day. Okay. I have a couple of here, and so we'll just actually go on to this, and Becca can weigh in here. I know she's got some differing opinions. So Misa 1930 asked thoughts on injectable estrogen versus creams versus patches. So I know you like the patch. It sounds like mostly.
I like the patch as an introduction. So creams, unless it's an intravaginal cream, which I think are necessary for like a localized estrogen support, intravaginal does not get systemic. It's going to be much more localized. Creams in general, though, create very high highs. And so research even shows, especially if you are predisposed to migraines or if you have estrogen dominance in general, creams are not going to be the best bet. I find patches are the best first form for people to start with. It seems to be the most well tolerated. You can start at a very low dose. It does create a systemic effect of estrogen. But if you find that you cannot get to blood levels that you need for like osteoporosis protection and those types of things, moving eventually from patches to an injectable form, I think is probably going to be the next step you need to take. It's not always necessary. Some people can absolutely get to blood levels with patches, but some people can't. And so injectable is just so potent that I find it's not a great introductory option because it's too powerful. People are too symptomatic with it.
Yeah. The only thing I would argue is that with Vital Medical, they go really low and slow. So that's nice. I've had a lot of people switch over to the injectable estrogen and we're getting better results, but it again is very, very low dose and it's done 2 to 3 times a week. So that we get a little bit more even dosing. I do want to add though, that from a perspective of cost, it is going to be more expensive and some people don't want to poke themselves. So I would agree on the patch. And then I would just say here, low and slow. Your OBGYN is not necessarily going to give you all options for the dose in the patch. And so if you are going to go in and ask for this, or they're going to start you on this, ask them to start you on the lowest dose. Because if you have a higher patch dose, sure, you can cut it in half, but I've just seen people gain weight tremendously, become very watery, bloated, breast tenderness, bitchy, like mood swings all over the place. Do your due diligence, ask them for the lowest dose patch. You can always go up. Introduce one at a time as well. So typically, we've talked about this on the other podcast as well, where we go over all forms of HRT. We talked about pellets, we talked about, suppositories, creams, injectables, patches, all these things. Do one thing at a time so that you can let your body adjust to it and that you, again, know what the variable is instead of starting both at once. And then all of a sudden, everything is a mess and a disaster. And you're like, well, what was it? Was it estrogen? Was it progesterone? And then the last thing I'll say on this is make sure that it's actually estrogen and progesterone. So in the pharmaceutical world, Prometrium is going to be your oral micronized progesterone. The lowest dose that comes is 100 milligram capsules. So you might need something compounded if you need less than that. And then in the estrogen patch, like that is estrogens. But when you're thinking birth control, because OBGYNs, I think there's starting to be a shift, they used to just prescribe birth control, right? These synthetic hormones that do the body more harm than good. And that's very clearly laid out in the research, especially after the age of 62, I believe, right?
Yeah.
So make sure that what you're getting is real estradiol and progesterone. The next one here is Nicole Dykud. Giving it my best shot, babe. So she asked thoughts on digestive enzymes, and I wanted to answer this question because I think that so many people could benefit, but I want to talk about like what they are and what other forms, you can start with. So your body is your digestion system is a north to south process, and your body is all interconnected. We talk about this gut-brain axis all the time. Digestive enzymes are secreted by your pancreas, but they're also in saliva. And so when you are thinking about food that you have, Becca and I are fasting today because we're going to Cabo on Friday and I'm hungry. Okay. It's noon. It's 12:30. I want to be skinny in my bikini. Should have thought about it 2 weeks ago.
Maybe like 3 months ago.
I was joking with a client about this. Is a side note. I was joking with a client this morning about like if I truly cared about being like real tight and fit for this trip, I would have started in January. I'm like, I have way too much going on in my life right now to think that's my top priority. But okay, when you're thinking about food, like I'm thinking about lunch we're going to eat, I'm starting to salivate for that. I'm excited because I like to make food that tastes good. I don't like to just have bland food. So in your digestive secretions here, there are digestive enzymes that are going to help you break down your carbs and your fats. When it gets into your stomach region, we're going to have stomach acid and other enzymes to help you break down your proteins. And you're getting even more enzymes from your pancreas and bile as well, because your stomach acid is triggering these things. So if you are someone who is struggling with digestion, you feel like you are not absorbing your nutrients, you feel like food is sitting in your stomach like a brick, that it takes forever to digest, if you're on a GLP-1, if you're struggling with what you think is gastroparesis or gastritis, if you're having a lot of bloating after meals, digestive enzymes could be helpful to give a little assistance chemically. Because also, if you are not chewing your food properly, sitting down with your meals, eating undistracted, this could give you more support on the chemical side. So stomach acid and digestive enzymes. What I would do is I would start with digestive bitters. Now, the only downfall of that is they're going to be more of a liquid tincture. So again, we're traveling this weekend. I wouldn't bring bitters with me. I'd rather bring a capsule of digestive enzymes and some betaine HCl I can take with my meal. It's easy peasy. So my thoughts are they're fantastic. I would just start, supporting with maybe some bitters. 15 minutes before meals, you could do a little apple cider vinegar as well. If you are going to do a digestive enzyme, I can tell you that one of my favorites, at least, is Thorne, their advanced digestive enzymes. Those can be great. If we are looking at a stool test and we're seeing elastase 1 very low, pancreatic insufficiency that's more severe, I'm using PAN9XES, extra strength from Metagenics. That's a great one as well. But the advanced digestive enzymes is more broad spectrum, and it's actually going to cover all your digestive secretions because there's some bile support and liver support in there as well.
Mm-hmm. Yeah, I would agree. I like Digest Gold too. I find that one's another one that I like a lot.
Enzymatica?
Yeah, comparative to Pan9X Extra Strength, just because of the capsules of the Pan9X are kind of like chalky, and some people struggle with swallowing those. But yeah, I think digestive enzymes are overall very well tolerated. But again, they're gonna support a process, right? Like if there's bigger issues going on, they're not a fix. They're not, unless it's true pancreatic elastase deficiency and insufficiency, you're going to need them, but we also typically have other things going on. So
yeah. And one of the things I would say regarding using them in certain seasons could be helpful here too. So if you're going through pregnancy and postpartum, you're highly stressed, there's a lot going on, this can help you get the most out of your food. I took betaine HCl, especially when I was having heartburn with Ethan. Oh my lands. Heartburn is just the worst. I don't know how people live with it. And so I can't stress that enough, because betaine HCl is something to support your gastric secretions of stomach acid, hydrochloric acid that you can take, because most of the time, 9 out of 10 times, it's too little stomach acid. So that could be a game changer there. But a very high stress season could be a time that you use digestive enzymes. If you've had to go on antibiotics or other medications, that can cause inflammation with your pancreas and lower the secretions. So if you're dealing with a lot of GI issues overall, I just think it's wise to keep them in. They are a nice, gentle biofilm disruptor as well. So that can help keep other bacteria in check. So there's a lot of benefits to them. They're not going to harm you necessarily. Like we wouldn't expect you to see like a negative reaction from them. So I think it's absolutely, fine, and see how it helps you. When we think about your food and what you're consuming, quality matters, but also you being able to absorb that. And for some people, when we look at our genetics test, like our FOOT2 gene, we can see like, hey, this person is naturally going to lack diversity in their gut microbiome. They're not going to have as much support with intrinsic factor. So we may need to support that with digestive enzymes, or if they're taking other B vitamins, vitamin D, different things like that, have things like intrinsic factor built into the product so they can better absorb it. or do more like liposomal or oral, and which bitters are. All right, 2 more. Superprete. Does borderline low hemoglobin, iron deficiency, anemia mean vitamin A deficiency as well? So actually, vitamin A is very correlated and linked in the research to being a cause of iron deficiency anemia. So this can help you reduce the risk of anemia because it's going to improve your hemoglobin and ferritin levels. But at the same time, I would do an intracellular nutrient test to see what my vitamin A levels are.
Yeah. I think at the end of the day, if your iron deficiency anemia is happening and like you're full blown low iron, low ferritin, low hemoglobin, we have to also look, why are you not absorbing things? Like, because yeah, you absolutely also probably could be vitamin A deficient if you're not maintaining levels of iron either because of GI based issues. But vitamin A is also toxic at high levels. And so you don't want to just blindly dose with vitamin A or with any of, the supplements or vitamins that can become toxic at high levels. Like selenium can also be toxic at high levels. Iodine can be kind of tricky when you go higher levels. So we always like to test intracellularly if possible. And things that you have to look for, like cod liver oil and retinoids and bile support and liver supports, all can have vitamin A in it. And so you got to be careful with when you're putting multiple like multivitamin or multi-nutrient based supports in, because a lot of people don't consider the overlap that happens among all of those. So we are always coming at iron deficiency anemia. I think because of a couple of posts that Liz and I have made, I've seen it so much in my DMs in terms of people having either true iron deficiency anemia, or they're having super low ferritin with normal iron, or all these dysfunctions going on. And you have to kind of look at it. Okay, yes, you can take the lactoferrin, you could take, the biotin, or you can take these things that are going to help with absorption and going to help with the cofactors, but you have to figure out why you're iron deficient in the first place.
Yes. And I have a reel coming out. It's in editing right now, but I've got real fired up about this last week because I had a woman basically say that she's exhausted, her hair is falling out, her iron was 29, or excuse me, her ferritin was 29. Her doctor says it's normal. So I went back digging and I basically called the doctor out and I was like, back in 2020, so 6 years ago, the ferritin levels from the American Gastroenterological Association actually changed from 15 to 45. So in my reel, I'm like, if math still maths, 29 is less than 45, that's not normal. And she's symptomatic. So why don't we help address the person and their symptoms and dig deeper? Because in that particular case, low ferritin, I don't know if she was a cycling female or not, but it's still below that threshold that we want to see, around 60 to 80, can absolutely contribute to the hair loss and the fatigue. But furthermore, so can many other things in the body, right? Like thyroid, other deficiencies. Growing your hair is actually a pretty energy expensive job. So, I didn't have time to go into all of that. But on the topic of ferritin, we have a whole iron anemia guide that breaks all of these patterns and trends down and what you can do with it. Like Becca mentioned a few, if it's biotin, if it's lactoferrin, like there could be things that we want to do, but I don't support taking oral iron because you can feed pathogens and that can make things a lot worse. It's also pretty harsh on the gut. So if you're truly iron anemic, meaning you have low iron, low ferritin, then you are going to want to do other things such as cooking with a lucky iron fish or doing an iron patch and maybe even doing some transfusions if it's really that bad. Like someone told us that her ferritin was a 3.
Jesus.
Like, how are you even getting out of bed? I would be so exhausted. And I remember I had to fight with my doctor when I was bleeding so much after Ethan. We checked my ferritin. It was only like 11 and then it eventually came up to 18. And I'm like, oh my gosh, like this is why I have been so exhausted on top of having a newborn, right? Where you're up all the time. And it's just newborn life is a season of its own. Last question here that we're going to address. So BU Wellness, do you offer mentoring for practitioners, business and coaching? So very fun. We do. There's a funny story about that. So actually, I'll tell you this and then I'll tell you about Elevate, which I just named it Elevate. I hope you like it.
I did like it.
Perfect. I was also
like, as long as it's not trademarked already, I feel like it has to be trademarked.
Yeah, I don't know. Well, I was thinking that we should do something with the logo where it's like Elevate because we're gonna have 8-week cohort
for sure.
So, really quickly on the we do portion, Art and I, when we got married 10 years ago in April, our church would not marry us because we already lived together. So we had 2 options. We could get married at the country club and have a pastor who was a very entertaining pastor, come and marry us, or we would have to have one of us move into one of the homes through our church until we got married, which was not going to happen. Yeah. Okay. Thank you for that offer, but no, thank you. So we had this pastor, and it was really cool, like how he interviewed both of us separately. We had to submit all this stuff. We wrote our own vows. It was really cool. But my husband's best friend, Adam, the best man, didn't like this guy. Like, they did not get along. And so the whole time, like through the rehearsal and everything, Adam was just in the background, like, we do. And so it's just like this ongoing joke every time I hear we do. That's what it makes me think of. But anyways, that's a decade ago. Now I'm old. So we are launching. It is going to be called Elevate, an 8-week cohort for practitioners. And in this, we're going to have a couple different tracks. So we're going to be talking a lot about like the business side. And if you are newer to the business, helping you with some of those foundational things. If you are more established, but you need to grow, you need to scale, you need to niche, you need to brand better, how you can do that. And then of course, we're going to have, the practitioner mindset. Like I put in here, week 0 is the practitioner mindset, and how are you taking care of yourself? How are you showing up for yourself? How are you showing up for clients ultimately, right? What space, headspace, mental, emotional space are you coming into your calls with? Because that is very, very important to avoid burnout, to give clients the best service that they deserve. And then throughout the 8 weeks, we're going to be going through a lot of different topics related to complex cases, the 10,000 foot view. Like, how do you take all your knowledge, all your education, all these things that we know about the body and apply it to that individual person, because it's so nuanced and can be very complex, right? So when we had people filling out the interest forms for this program, many of them said, I need to fill in educational gaps, and I need to understand, like with protocols, how do I make them strategic? And I think that's a large miss. And eventually, Becca and I would love to have our own university, but that would take a very long time. So we're going to have to figure that out, because we've both done so many different certifications and courses that have a ton of benefit in their own way. We want to like marry those things together. So until we can do that at a larger scale, we're going to be doing this Elevate practitioner mentorship 8-week cohort. It's going to be intimate. We're only going to accept 10 people for the first round, because we want to know you. We want to know your business. We want to know your struggles. And we want to leave out everything that we did not like with the probably over $500,000 worth of mentorships that we've done over the course. I mean, we've probably spent over $1 million between our education, our mentorships, courses, conferences.
Yeah, absolutely. And honestly, like, I wouldn't take back any of it. And I know Liz probably feels the same way, because you learn from all of it. You learn what you need, you learn what you don't need, you learn how you like to learn, you learn how you don't like to learn, you learn the type of people you want to be around. And so, it I think has been invaluable. And it's why any new practitioner that messages me asks me, how did you learn what you learned? Like, how do you know this information? How did you gain this knowledge? The number one thing I always tell people is find a mentor. Find a mentor that does what you want to do, that has the knowledge you want to have, and learn from them, because it is going to be so much more valuable than any certification you could honestly find. Because I'm not saying that the certifications haven't been helpful, but after you find like a foundational one, so I did FDN, Liz did NTA and RWS, like I think once you get the foundation of the thought process around how to approach cases, then the actual application piece, learning from a person, is so much easier. And it's so much faster paced in terms of getting you where you want to be. And like any successful person will tell you, buy time, because you can never get that back. And so I will always invest in people that know what I want to know, because they're going to teach me a lot faster than if I try and go figure it out myself.
Well, and their life experience and their failures, you learn more from your failures than you do your successes.
Yes.
So I want to learn from people who have failed and rebuilt. Like if you look at any great entrepreneur, they've had a ton of failures. And so they're going to tell you what not to do. The other piece with a mentorship program and having someone guide you through your healing journey or through helping, clients, is that we can see things that you can't. we all have a level of bias and we're really close to a situation, right? And therefore that creates a level of blindness in some ways. So we want to help you spot those things and help you think a little bit differently, think strategically, because just what we podcasted earlier with Dane, and we deal with some very complex cases in our practice. I'm not going to tell you that we don't have clients taking multiple supplements and peptides, because we do. But at the same token, we work a lot with our clients on the diet side, the foundation side, the mental, emotional side. And many practitioners don't. So if you're going to work with us and be mentored by us, you can expect that we're going to tell you that it is not sufficient to have a test and a 12-week protocol that's not rotating, that's not being adjusted with the diet as well, that is a one-sheet handout on a anti-parasite or antifungal or whatever these diets are that people are doing. No, we want to get in the weeds. Like, does that person have histamine issues? Do they have FODMAP issues? Do they have glutamate issues? Do they have parasites and fungal infections and all the things that are kind of creating a trifecta here? You need to be able to customize that diet according to that person and that individual, because you've taken into account all of the systems, not just, I did a GI map, this is what the stool test shows, so these are the supplements that align with the protocol, because that's how some programs teach, and there's benefit and value to that in some ways. But when you have a complex person sitting in front of you who's tried a lot of things, you have to address it differently. So yeah, we're really excited about that. I just named it Elevate, and I'm glad Becca liked it. We could always change it, but that's just what I came up with. And then after the fact, I was like, oh, you said let's do it in cohorts for 8 weeks. So it's digestible. We get in, we do a lot of work. And then my goal would be that you go and you implement strategies into your cases and into your practice. And then if you need to come back for another 8 week, or you need to go into a further deeper mentorship with us, we can look at that option as well. But we wanted to start this mid-March, end of March, to help practitioners. So if you've not already done so, message one of us on Instagram, your email. We can add you to that list, and we'll be sending out an announcement when registration opens with pricing and details. And there's going to be layers to this as well if you want to go deeper on the marketing and branding side too. So lots going on in the FitMom world, lots going on in Liz and Becca's lives. And we're excited that we get back here to do lives with you. Of course, next week we won't be, because we're going to be traveling, but in 2 weeks we'll be back live on YouTube again. And if you're with us, say hello, leave a comment, ask a question. We'll make sure that we cover those in the coming weeks.